Good evening, everyone. Thank you for taking your time and joining us today. And on behalf of ECA College of Health Sciences, I extend a warm welcome to all of you. So, I will be your host for our webinar. My name is Stephanie, the student recruitment consultant for ECA Online Higher Education. And I have been in the education industry for the past 4 years. And with ECA for the past 12 months, helping students achieve their goals and aspiration. So today, throughout our webinar, we will be discussing the courses that we offer, why leadership and management matters in healthcare, key skills and competencies developed in the program, how our program prepares you for a leadership role, career opportunities in healthcare leadership, and of course, scholarships and promotions. And now it is a great privilege to have our Deputy Dean as our speaker tonight to give us a better understanding of health management leadership. And it is my honor to introduce him. He's a senior executive with over 35 years of experience as a health executive consultant, project manager, director, and chief executive officer, as well as clinician, academic, and author. Professor Gary has worked in both the for profit and non for profit health care sectors across three Australian states, as well as the higher education sectors, including project lead roles in major infrastructure and change management, and organization wide roles in workforce development, clinical governance and safety, and medical education. Please help me welcome Professor Gary Day.
Thank you for attending this early meeting with me. My name is Professor Gary Day. I am a Professor of Health Service Management at ECA in the College of Health Sciences, but I also am the Deputy Dean Programs for the Higher Education Division. So my role is around programs, program quality, new programs, teacher quality and innovation across the College of Health Sciences, the Asia Pacific International College, and the Higher Education Leadership Institute. But this morning, we're going to talk about health management, why it's important, the type of program we run, and what are the opportunities. So I come from a clinical background. Originally as a registered nurse and midwife, but have spent many years in executive health management roles, both in Australia and internationally. And I've also spent a lot of time in the higher education sector, particularly in the area around health management. So I have a really broad experience in both the education of health service managers, but also managing major organizations. So I guess the question is, why is health management important, or why is leadership and management important in healthcare? I think it's for three main reasons. Really, it's around quality, safety, and cost. And whenever you're working in health management roles, or health leadership roles, it will come down to probably one or more of those three things. It's either around making sure your systems and your processes and your services are safe, they have a level of quality that meets both internal and external benchmarks, and that it's run efficiently and effectively. And I think when I think back to all of my roles, there are other things that pop up, but those three things keep coming up. Um, so they keep coming up for a couple of reasons. One is that healthcare is becoming more costly year on year as our population ages, particularly in Western countries. I think the other thing is that um, healthcare organizations are very complex, and probably what makes it such an interesting profession to be in and an interesting industry to be in is that you won't find a more complex and diverse area in which to work, manage and lead, for example. Um, you've got a complexity around the staff that you have to manage, doctors, nurses, allied health professionals, other staff. You have the complexity of the patient themselves, and you have the complexity of the system in which we work and operate. And all of those things are moving around. So your ability, good morning, Stephanie, your ability to be able to manage all of those things at once never makes managing in health services dull or boring. There's always something new happening. Um, so I think, it's a great job. It's a great profession to be in. And I think the things that drive, you know, what makes it so interesting is what's happening in the industry more generally speaking. I think for one, consumers are much more conscious about what they want and what they need. Um, and I've gone off the screen somewhat, but I hope that's okay. Um, so there's, you know, consumers are wanting more and more from their health service provider. I think, secondly, there's an increase in chronic disease, which puts pressure on our systems, both in terms of staffing and cost. And I think, health budgets are certainly becoming tighter year on year. So there's a whole lot of challenges in the industry that make it such an interesting and fascinating place to work and develop as a leader. Um, so with all of that in mind, I've played a role in kind of shaping the Masters of Health Service Management, or the Master of Health Management program, at the College of Health Science. And what we've tried to build into the program is um, practical skills that will be useful for you as you move into working as a health manager. And I think, there's the obvious ones like leadership and management, um, and strategic thinking and change management, but there are the other ones, such as finance, um, clinical governance, working together as a team, um, critical reflective practice. All of these things come together to provide a range of skills. I spend some time with students talking about how to develop your leadership within a health service environment. What's the same as leading in, say, other industries, and what's very different. Um, and I think I get back to the complexity of the relationships between the different elements of healthcare management makes it so interesting, and makes it that complexity. You'll never have a boring day on the job as a health manager, if that's your chosen career path. I can tell you that. I think often about why, I think back on my career in health management, and my career in health management goes back to about 1996, a long time ago. Um, and I think, combine my clinical practice and my management and leadership practice. Um, my health management degrees, as much as anything, have opened up opportunities for me in a range of different settings and a range of different organisations, both in Australia and internationally. So, I've worked in, 3 states in Australia in different health leadership and management roles, such as a CEO of a community hospital, the director of clinical services of another country-based hospital, um, to a range of senior director roles in the health department, um, and then international opportunities arose for me, such as doing consultancies in Vietnam and China, Saudi Arabia, the UK, and the UAE. Um, and certainly I've taught overseas in health management in Hong Kong and Singapore, and the UAE and the UK. Um, but it does allow you to travel. I mean, one of my last jobs before coming here to this role was I spent quite a number of years in the Middle East working in a medical city as a C-suite member. And all of these things were possible because um, my health management degree gave me an opportunity to think about how I could um, provide my skills and what I could lend to projects anywhere in the world. So it's a real ticket for you to to travel, to experience new things. And there are so many different roles within health management that it's just very difficult to pinpoint all of them, because you could be working for the World Health Organization in a project in Africa. You could be, as I said, working in the Middle East in a major medical city. You could be working on a small project in a major hospital, or you could be working in a country area where you've got responsibility over a large geographical area. Um, you could be leading small teams of 4 or 5 or large teams of 5,000. It just really depends on what you want to do, what excites you in the area of managing health services. That gives you opportunity, and it gives you scope and scale to pretty much follow whatever you want to do, should you wish to do that. Um, our program is constantly changing at the College of Health Science. We are looking at the moment, and certainly my role is looking at the moment to develop a lot more industry contact within the Masters of Health Management. So industry-based projects, industry visits, um, looking to provide students with competency in software applicable to health management roles by the time they finish their master's degree, um, and opportunities with having completed your Masters of Health Management, being able to join our professional body in Australia, the Australasian College of Health Service Management. So we are looking to infuse a lot more industry experience and a lot more industry-based problems into our programs to make it feel like it's almost like on-the-job training without being on the job. So you come to CHS, you get some great international academics teaching you both theory, and then we'll bring the practice into that with the industry-based linkages and problems and work-based learning and so on. Um, I'm just trying to think what else I've got here that I wanted to talk about right now before I ask for some questions. But I think, there is a great opportunity both in Australia and overseas for people with qualifications and experience in health service management. I'm just going to have a glass of this. As I said, there are opportunities worldwide, and they're only as limited as you are wanting to experience these things. So, um, every week there are things coming across my desk that I see around managing projects all around the world. Um, and so, these opportunities will be available to you as well. And the salary expectation is different wherever you go in the world. So there's no kind of one salary band, I guess. And the higher you move up in health management, I guess the more you will be paid. So, for example, if you've got an Australian Masters of Health Management degree and you decide to go and work in the Middle East, you'll get paid quite well there. Um, if you go to some other countries, the pay mightn't quite be as good as that, but it will still be a good salary. In Australia, health managers at the lower end are probably um, as starting off as, say, a project officer or that kind of thing might be in the 120,000 Australian dollar range, then moving up as you become more senior. So it's just a matter of progression, taking opportunities as they arise, um, practicing your skill. And I can say to you, when you come and do a degree such as a Masters of Health Management, we have an emphasis on both leadership and management. You need to learn both skills. So you'll learn the management skills around finance, around strategic planning, around change management, around kind of health statistics, for example. But the leadership skills are equally as important. They're the ones that are around leading others, influencing people, creating good, strong professional relationships, teamwork, and so on. These are equally important if you want to be successful as a health manager, and they are the type of behaviours and skills that we cover and teach in our master's program. So I really encourage you to think about health management as a career choice, particularly if you've got a clinical background as well. And a number of our students come from a wide range of clinical backgrounds. We've got doctors, nurses, pharmacists, physiotherapists, um, just trying to think what else we've got. A couple of dentists. We've had kind of radiographers, and we had some people who haven't come from a clinical background, and that's not necessarily an impediment. So we've had people who've come from a business background who want to move into health management, um, and and so on. So equally, a health management degree can really strengthen your ability in a health setting if you come from a non-clinical background. Um, So that's kind of health management and the program that we run in kind of context. The program, the health management program, we have basically 3 degrees. 2 of them are kind of nested within our masters. So you could start off doing a graduate certificate of health management, which is 3 units, and then there's a graduate diploma of health management. But most of our students, when they come to Australia, and they want to study, they do the master's program. So you'll be studying 3 units a trimester, and there's a 1 trimester break. So you can get your master's completed in about 18 months, or if you decide not to take a trimester off, in a shorter period of time. Um, as I said, our staff, we run the program in Sydney and in Brisbane. And on each campus, we've got highly experienced international academics that have worked in a range of settings um, worldwide. And of all the places that I've worked in my career, the staff, the skill and the breadth of experience of the staff we have at ECA is second to none, even better than some of the universities that I have worked at. So if you come and do a master's with us, you will get a great experience. You'll meet some great people. You'll have great educators and academics to guide you along the way. Um, and you'll be in a great country. So it's all upside from my perspective. And what it requires from you is really your commitment to learn and to take in ideas and to discuss them in class and and to experience both the theory and practice of being a health manager. So I just want to stop there for a minute because I've been speaking for about 20 minutes now. And I just want to ask if there are any questions from what I have covered so far.
Hi, everyone. Good morning, Professor Gary. Thank you so much. That was a very informative discussion. So, while we're waiting for the questions, okay, and before I discuss the fees and the scholarship that we had at the moment, so that was Professor Gary was able to discuss why leadership and management matters in healthcare. What are the key skills and competencies you can develop in this program, and how our program prepares you for a better leadership role? So I bet everyone is excited to know as well what are the fees of these courses and what are the scholarship that we offer. You may enjoy studying fully online. Okay, just to add as well that these courses are all delivered online. Okay, um, making you experience stress-free learning. Okay, designed for your convenience as well. So this is tailored for your unique schedule to fit in your needs. You will also gain access, okay, to additional learning resources to further enhance your skills. So ECA CHS is offering limited scholarship for our eligible domestic students. And I'm excited to introduce you to the Dean Scholarship at ECA College of Health Sciences, specifically designed for our Master's Management program. This is more than just financial support, it's also a gateway to unlocking new possibilities in your career, as what have Professor Gary mentioned earlier. Now, here's the thing on how you can avail the scholarship or apply. These scholarships are limited and highly competitive. So we will only select few students that will be awarded. And don't worry because flexible payment plans and fee help options are available, okay? Which we will also go through a bit later. So now, ECA College of Health Sciences is a registered fee help provider. So Australian citizens have the option to apply for government loan to cover their tuition fees. So how it operates during the application process, you'll complete an electronic Commonwealth Assistance form or what we call ECAF to apply for the government loan. Now, typically repayments are income based and commences when your salary exceeds the fee help income threshold. Now, fee help is applied when you enroll per subject. So, for example, if you are enrolled to our master's, there are 12 subjects on it to complete, and each time you register to enroll to commence a subject, the subject fee is 1,900 for those who have scholarships and 2,600 for non-scholarship holders. That will be applied to your fee help loan. Now, students who have the option to choose to enroll in additional subjects such as second and third subjects depending on your preferred base. For more information, you may visit their website at studyassist.gov.au. So, we have a very important announcement that we have a current promotion. Students who wants to enroll for our upcoming intake, okay, will receive a 12-month complimentary subscriptions to ECA online skill builder short courses and employability advantage. Now, ECA online skill builder courses are a great way to enhance soft skills needed in a professional environment. You may complete short courses in leadership, interpersonal skills, and creative problem solving. Now, Employability Advantage offers essential tools and resources to help students launch their career and gain the confidence and skills needed to succeed in the professional world. Let me just also quickly go through the support, student support that we offer. So our goal is to provide you with the resources and support you need to succeed academically and personally. So in addition to our professors, coordinators, and myself, we have also dedicated and accommodating student support team ready to assist you. So here at ECA College of Health Sciences, students' learning support is a priority to ensure that every student has a smooth and enriching learning experience. So the institution provides a range of dedicated academic services, including online academic resources, IT support, and language learning support. Now, these are designed to assist students in navigating the challenges in higher education, especially to those who are pursuing online courses. Additionally, CHS offers career and course advice, to help our students align their studies with their professional aspirations. The support system is a robust and tailored to enhance both academic performance and employability, ensuring students are well prepared for the real world success. So we're excited to announce that the next intake is now open for accepting applications. Okay. So the intake date is trimester one will be on February 10, 2025. Now for the scholarship, the cutoff date is January 30, 2025 or until seats last. Okay, just a quick one. So for the admissions requirements, okay, our masters, we have alternative requirements. So we go by educational side as well as working experience. So if you have a bachelor degree recognized AQF7 or equivalent to any higher qualification in a health related discipline, or if you have completed graduate diploma or graduate certificate. Now, if you have as well a minimum of 3 years relevant working experience in health related field, okay, the relevant work experience must be demonstrated through CV and a statement of service confirming the dates of employment and position held within the organization so we can accept it. For our graduate diploma in health management course, again, bachelor's, recognized bachelor's degree, AQF7 or equivalent, higher qualification in health related discipline, or if you have successfully completed the graduate certificate in health management. Okay. We will also accept if you have minimum 2 years relevant working experience in health related area. Okay. And it should be demonstrated through a CV or statement of service confirming the dates and position held within the organization. Lastly, for the graduate certificate, again, recognized bachelor's degree, equivalent to AQF7 or higher qualification related to health discipline, or if you have minimum 2 years relevant work experience in health related field. And don't forget that it should be demonstrated through a CV or statement of service confirming the dates of your position and employment held in the organization. If you have further questions, I know if you're shy or what, you can just simply contact us. I have flashed on the screen my details. And if you're also interested in learning more and applying for our Dean Scholarship, you can email me at stephanie.binag@eca.edu.au. You may also contact me directly for the phone number I've shown on the screen. So that brings us to the end of our presentation. Thank you so much, everyone. Thank you, Professor Gary.
Thank you very much, Stephanie. Thank you, Alice.
Thank you,
Thank you,
everyone. Have a good
everyone.
day.